So with people that are dealing with anterior shoulder pain or proximal bicep tendon irritation, this is a common thing that I'll give to people early on just to help them desensitize some of the irritated tissues here in the front of the shoulder. It's a really simple soft tissue massage technique. You're not doing anything special with this technique. You're not changing the tissue that's underneath by any means. All you're trying to do with this technique is to just bring blood flow to the area, try and facilitate healing to an irritated tendon that's on the front of your shoulder, and allow things to become less sensitive to certain movements. So people who have proximal bicep tendon irritation very frequently will describe this arc of motion when they reach their arm up overhead that tends to be most sensitive. So things tend to be okay towards the bottom part of your range of motion, and as you get to around this like middle or 2/3 mark of your range of motion, things tend to get a little more sensitive. And then as you get up towards the top, things become a little less sensitive. So that arc of motion, that range where things are most sensitive, we can actually target our soft tissue work so your arm is in similar positions to that. So what we're going to be doing is you're going to be using your hand to find that irritated tendon that's on the front of your shoulder. And again, working on it here is all well and good, but we're going to try and be a little more specific in how we do this work. So what you're going to do is you can use a couch, a chair, a bench, your bed, whatever you have, and you're going to be resting the irritated arm on top of it. And the whole idea behind resting it on something is so that we can use our body mechanics to manipulate the position of the arm to mimic those like sensitive ranges that you have when you're actively lifting your arm. So you're going to find that tendon that seems to be a little irritated. You can rock your butt back to your heels until your arm is in about that position where things tend to be most sensitive, and then you can just work on the tendon. You can work back and forth, you can work up and down, just spending maybe a minute or two here at most. Once you're here, you can also do some sustained pressure where you're pressing on the tendon and you're just rocking your butt back and forth close to your heels and then sitting tall. And you can see this is mimicking as if you're lifting your arm up overhead. Very similar to just lifting your arm up overhead, except that you're not having to actively do it. Again, just for another minute or two in this position. You can also do some sustained pressure to the tendon and then bend and extend your elbow, because again, this is the proximal bicep tendon. So your biceps, when you are bending and extending your elbow, in a theoretical sense, the tendon should be sliding underneath your fingers with some of that sustained pressure. So again, the whole point behind this technique is just to stimulate some blood flow to the area, facilitate healing to an irritated tendon. You're not changing anything. We're just hoping to see if we can desensitize the area. So maybe try incorporating this a couple times throughout the day and see how your range of motion starts to feel over time.